Hello everyone. So this is the part 2 video of upper limb. In the part 1 we have already discussed the muscles of anterior compartment of forearm. So in this video we will discuss the posterior compartment of forearm. Muscles of posterior compartment of forearm. So as we all know, the muscles of posterior compartment, it is divided into a superficial layer of muscles and also a deep layer of muscles. Okay, the superficial layer of muscles consists of 7 muscles and the deep layer of muscle consists of 5 muscles. And what all are the superficial layer of muscles? It includes these muscles, okay, that is brachioradialis, extensor carpi radialis longus and brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris and also acronis. So all these superficial muscles are having a common origin, that is lateral epicondyle of humerus. So I guess this much is clear. Though the posterior compartment is divided into a superficial and a deep layer. Superficial layer consists of 7 muscles and deep layer consists of 5 muscles, and these are the muscles, and all the superficial layer are having a common origin, that is lateral epicondyle of humerus. So these are the muscles, superficial layer of muscles. The first one is brachioradialis muscle. So brachioradialis muscle, its function is flexion of elbow. So then comes all the posterior compartment muscles are extensors except this brachioradialis, which flexes the elbow. Second muscle is extensor carpi radialis longus and brevis. So I've already told you that that is radialis. When the word radialis comes, it corresponds to the radius bone and also it corresponds to the thumb. Is that clear? Yes. So what will be the function? So it is attached to the second and third metacarpal bones. So what will be the function? So it extends and abducts the wrist. Note that it is abduction, not adduction. It is abduction of the wrist. So then comes the extensor digitorum. Extensor digitorum, of course, it will be inserted into the digits, right? And what will be the function? It extends the digits second to fifth digit. Yes. Then comes the extensor digiti minimi. Digiti minimi, of course, it is related to the fifth finger or the little finger. So it extends the fifth digit. And what about acronis? It assists in elbow extension. So from the name of these muscles itself, we can understand the action of these muscles. Or we can guess the actions of these muscles. So then comes the last muscle, that is extensor carpi ulnaris. It is ulnaris, so it will be related to the medial side, that is the little finger. So then comes the what is the function, that is extends and adducts. There we have studied abduction. Here we studied that is ulnaris corresponds adduction of wrist. And what will be the innervation? It is of course radial nerve and its branches. Posterior compartment is supplied by the radial nerve. Coming on to the deep muscle layer. Deep muscle layer comprises 5 muscles, that is supinator, then we have abductor pollicis longus, extensor pollicis brevis and longus, and also extensor intesis. And so the first muscle is supinator. So what will be the function of supinator? The function will be it supinates the forearm, right? Yes. Then we have the abductor pollicis longus. So abductor pollicis longus, it abducts. So whenever the word pollicis comes, so it relates to the thumb. So it is abductor pollicis, right? So of course it abducts a thumb. Then we have the extensor pollicis brevis and longus. So extensor pollicis longus and brevis, of course it extends the proximal phalanx. First of all, the brevis extends the proximal phalanx and also the longus the distal phalanx. Okay, that is the only difference between the extensor pollicis longus and brevis, the proximal and the distal phalanx respectively. And what about the extensor intesis? It extends the index finger. So it is as simple as that. So the origin of these deep layer of muscles, it originates mainly from the radius, ulna and interosseous membrane. What about the superficial muscles? It originates from the lateral epicondyle of the humerus. So here the deep muscle layer, it originates from the radius, ulna and also the interosseous membrane. And what about the innervation? That is PIN, posterior interosseous nerve. It is the deep branch of radial nerve only. So I hope this much is clear. If at all you understand something, please do like, share and subscribe to my channel, and thank you.